You're listening to an Airwave Media Podcast.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're your hosts, Dr. Jess and Sarah
and Dr. Sarah Scheinman.
And today we are joined by a very special guest to talk about a topic that should be important to all of us: health security, the resurgence of diseases, and of course, one of our favorite topics, vaccines. Before we get into it, something that caught my attention in public health is a lot of attention to aluminum. Aluminum as an ingredient, aluminum salt as an ingredient in vaccines. Aluminum salts are used as adjuvants in some vaccines, which I like to say is sort of like a megaphone for the immune system. It helps the vaccines work well and be effective. They're a very critical ingredient in vaccines. And so, many of us are concerned that if attention shifts to aluminum, if people start saying that it's dangerous and that we move to try to remove it from vaccines, it would have a really major impact. We could talk much more about this. And just to summarize, there is absolutely no evidence of harm of aluminum adjuvants in vaccines. Certainly no link to autism whatsoever. This is something we've talked about ad nauseum and we'll talk more about. Without further ado, let us meet today's guest, Dr. Seth Berkley. Sarah, do you want to read Dr. Berkley's really intimidating bio?
I would love to. And I was actually reading it before we jumped on with him, and I was getting a little nervous. But then as soon as we started talking, I realized that he's just the nicest guy. So I'm so excited for this episode. You guys, Dr. Seth Berkley, MD, is an infectious disease epidemiologist currently advising vaccine, biotechnology, and technology companies, and is an adjunct professor and senior advisor to the Pandemic Center at Brown University. He serves as CEO of Gavi, the Vaccine Alliance, from 2011 to 2023, co-founded COVAX, and founded and served as CEO of the International AIDS Vaccine Initiative. He also works with the Special Pathogens Branch of the U.S. Centers for Disease Control and Prevention, the CDC, the Massachusetts Department of Public Health, the Ministry of Health of Uganda, and the Rockefeller Foundation. He has published hundreds of articles, received numerous prestigious awards, 3 honorary doctorates, given 3 TED Talks, and was elected to the National Academy of Medicine. Dr. Berkley received his undergraduate and medical degrees from Brown University and trained in internal medicine at Harvard University. He's the author of the book Fair Doses, an Insider Story of the Pandemic and the Fight for Vaccine Equity. Dr. Berkley, welcome to the show. Thank you so much for being with us.
Thanks for having me.
Y'all, we are in the presence of public health royalty right now, so this is really an honor. And also, can we just take one moment to say, Sarah, Sarah's voice might sound a little funny on this episode because she is sick, poor thing.
I know, I'm so sorry, everyone. I'm a professor. I work at a university, and I adore my undergraduate students. Many of them are listening right now. However, they are little petri dishes. So we are well into respiratory virus season, and here we are. So
yes,
that's why we need vaccines.
Oh,
and there we go.
Love
That's exactly what.
Perfect segue. Sarah, did you get sick intentionally? No, I'm joking.
Just for this.
Dr. Berkley, we start off every episode with the same question. What is a news item that caught your attention, and why should people care about it?
So it's not a piece I normally read, but somebody sent it to me. The Independent, the U.S. edition, had on Tuesday an article entitled "Wave of Anti-Science Bills Pushed by Kennedy Allies Hit State Houses, Endangering Health Protections." And it tells us that there are more than 420 anti-science bills attacking public health protections and vaccines, milk safety, and fluoride. Actually, 350 of those are anti-vaccine, and so far 30 of them have been enacted in 12 states. And so the reason this wasn't on my radar is that I live in Geneva, Switzerland, and I focus more on global issues. Of course, the U.S. is a critical player in this, and so I focus on what the U.S. is doing, but I wasn't down at the state level. And this is about trying to hurt confidence for science and to use the influence of the federal government to make it okay for these things to happen at state level, which will have a long-term effect, making it even more difficult to reverse some of these when we get scientific leadership back.
And so you said it was about vaccines, fluoride. Did I hear you say milk as well? There's a big...
Yes, milk safety. And there's a lot of states have tried to push having raw milk available. And of course, the challenge is that, some people say it tastes better and, whatever, but there's a lot of health claims that go with it. And of course, what we know is that unpasteurized milk was one of the main sources of disease for young children in the past before pasteurization came, because you can naturally pass on organisms from the cow. And so it really is a risky thing. And this article talks about some deaths that occurred, some illnesses that occurred in addition to these bills that are being pushed.
Isn't it just maddening? I'll read these news pieces. It's like we're literally undoing decades of public health progress. We're moving backwards in time. It's yeah.
I think that's the point. And the point of this article is exactly that. But I recently wrote a piece in Science, and I went back to Thomas Hobbes, a famous philosopher, and during that time, about 350 out of 1,000 children died. And I would argue that's kind of the natural, mortality rate if you don't have any public health interventions. And of course, now the U.S. is down to 5 per 1,000, which, by the way, is not the best. The best country is 0.9 per 1,000. But if we start getting rid of all these public health things, yes, there are other things that are in this, clean water and sanitation and better housing stock. But, the majority of this stuff is infectious disease control, and vaccines are a key component. And if we start getting rid of those vaccines, we move back there. And I'll just say at the end, no parent wants to go through the horror of losing a child or ending up with a permanently disabled child. And that's something that we need to push back on, because, that is almost the exact definition of what civilization is.
There's this romanticization, I don't know if I butchered that, of the past and of, history and how we used to do things, and this appeal to nature. And do people remember what the life expectancy at birth was back then? And how people were, just suffering, as you just said, from all these things that we can now prevent. So it's very,
in the
very...
U.S.,
Yeah.
In the U.S. colonies, it was about 25 years. And in the U.K., it was, in the 30s, because, the U.K. was a little bit more urban, a little bit more civilized. But as you know, life expectancies now are getting into the high 70s, although in the U.S. they're much lower than other countries. But, in other countries, Japan, it's, in the 80s. And so this is a big result of the control of infectious diseases. Some estimates say that 500 million lives have been saved through vaccination over the last 100 years. And so, this is a pretty profound effect.
Sarah, do you want to jump in with any questions for Dr. Berkley?
Oh my God, excuse me. I was going to say, well, I think as long as we're talking about the spread of infectious diseases, that maybe a first place we could start here was the COVID-19 pandemic. And maybe you could talk to us a little bit about your work during that time, because I know you did some very, very important work.
So if I go back in history, the last big pandemic before COVID was an avian flu pandemic. And what happened at that time was they were able to make a vaccine, but high-income countries basically bought up all the vaccine immediately, and there was no vaccine available for anybody else. So we knew that is what was going to happen unless we intervened. So as soon as we figured out that this was beyond a wet market outbreak, remember it started out as a point outbreak, and we heard rumors even before they were confirmed of person-to-person spread, et cetera. we asked the question, is this the big one, or is this going to be a dress rehearsal for the big one? And in a sense, it didn't matter. And we began to plan what ultimately became COVAX. And the idea for this was, when you have a global pandemic, what you want to do is dampen down the spread as much as you can, and you want to do it wherever the disease is. And one of the fallacies in a pandemic is, nationalism, because, people, of course, and politicians rightfully are, paid, they're elected to protect their citizens. So you can see everybody's going to say, well, I have to protect my citizens. But if everyone does that and everybody now starts buying vaccines, and of course, at this point, we didn't know if any vaccines were going to work. So what people did is logical, is they didn't buy one vaccine. They said, okay, we'll buy 5 vaccines or 7 vaccines. And so what you have is, what you have at that moment then is basically all the supply being bought up. And so what COVAX was to try to bring forward a mechanism to have a provision of vaccines across many countries. Now, it was fascinating because this was during the pandemic. We ended up with 193 countries joining. Ultimately, we were able to deliver vaccines to 146 countries and 2 billion doses of vaccine. And we ended up with, the best response. So at the end, 57% of people in the 92 poorest countries, where about half of the population live, had primary doses of vaccine. That compares to about 67% globally. So not equity, not perfect. But of course, the risk population in high income countries is higher because a lot more elderly, a lot more people with chronic diseases. So, at the end, that's where we got to. But, it wasn't all rosy. We had a lot of export bans and vaccine nationalism and vaccine diplomacy. And the very poorest, so the lowest income countries, ended up in the first year of vaccine available only having coverage of around 1%. And so, one of the reasons I wrote the book was to try to clear up all the misunderstandings and misinformation that's out there, and to say, here's what actually happened, and we must learn from this, both the good things that happened, but also the bad things, and how we can prepare better, because it is evolutionarily certain that we will have more outbreaks. In fact, I argue we're in a moment of polyepidemics, and that we're going to see more of them going forward.
Okay, I want to hear more about that. The thing that really stresses me out with all of the funding interruptions and the rifts that are going on at the federal level, we're seeing interruptions to things like CDC's MMWR, Morbidity Mortality Weekly Report, disease surveillance, and there are things bubbling up across the U.S., right? We know bird flu, pertussis, all of these other West Nile. Right? There are all these things that are where we're seeing the spread of these diseases. So I would love to hear more about how likely you think it is that we'll, find ourselves in trouble. Could it quickly escalate to the COVID pandemic situation? How worried should we be?
Yeah, you mentioned it's an evolutionary certainty.
Oh, yikes, Sarah. We might take your mic away.
Oh my God, maybe. I'm sorry, but an evolutionary certainty. That's what I was. So can you talk a little bit about that? Certainty.
Yes, absolutely. So first of all, in terms of the risk, the estimate from a recent study, a Lancet Commission on Global Health 2050, is that in the next 25 years, there's about a 50% chance we will have a pandemic of COVID-like magnitude. So that's a big number, and you don't know when it's going to happen. And obviously, the predictions about the future are difficult because they're about the future. So we don't know that definitively. But the reason it's an evolutionary certainty that we're going to have more are a few factors. So first of all, the population is increasing. So we still haven't reached the maximum number of people. The growth rate is slowing down, which is good news, but we're going to have more people. We have more people in urban areas, people living in urban slums. We have more displaced people. We are obviously having a lot of war issues going on, instability that's going on. And then a big factor is climate change, which is going to displace more people. But it also means that the vectors that spread infectious diseases now go to much different geographies. So all of a sudden you're seeing diseases begin to move into places that have not seen them before, which of course means there's no natural immunity to these diseases. And so all of this together increases the risk of infectious diseases. Now, that's on the risk side. And now on the other side, to your point, with all of the withdrawal of surveillance systems and the ability to report on what's happening, and also the research dollars that go into. I mean, we're in a renaissance right now of science. Amazing what's happening. We're actually beginning to have vaccines that will target cancer directly, not the infectious diseases that cause cancer, which we have a few of, but actually the cancers directly. And, the government is pulling away from it. One example is mRNA vaccines. Now, mRNA may not be the be-all and end-all of vaccines. We can talk about the pluses and minuses, but no other vaccine can be produced as quickly. So, when the genome was published of SARS-CoV-2, wasn't called that at the time, but the coronavirus, they had in a vial a vaccine ready to go in 42 days, and they had at 63 days the first injection. Now, that was a novel product in a small company called Moderna. And, the point is today you could squeeze that down maybe to 20 or 30 days. And the reason that's important is if the next pandemic isn't a mortality rate of, let's say, 1.5% like COVID was, but was 20 or 30 or 40%, then every minute counts in terms of the time to get agents that can protect against this. And at least right now, mRNA is the best technique we have. So we saw the government pull away from a contract on H5N1 that was mRNA, a $600 million contract to produce that. And then we saw them shut down the research at BARDA, about $500 million worth of research. And there is some noise in the conspiracy sphere to say that we should make these vaccines illegal in the United States. And again, you're taking away one of your most powerful potential tools. If you have concerns about it, and you think it's not safe or you think it's not that good, what do we do as scientists? We do more research.
Right.
We don't turn off the research and pull away. And so this is why I think we are in a difficult situation.
So I'm curious, I've read some of what you've written, and you distinguish between the impact of vaccine inequity and hesitancy. So can we talk about those and which you feel is a bigger threat?
I mean, they're both threats. And so, the inequity issue relates to a whole bunch of things. I mean, what you should try to do is have the vaccines available to all those who need them. Now, you can never do that instantly. I'm not naive to think that. So there's always going to be a delay, but you want to do the best you can. And an example would be in COVID. What we should have done is vaccinate all the high-risk people, and that probably would have happened in high-income countries first. I mean, ideally it shouldn't, but let's just say that happens. And then you want to do the high-risk people in developing countries because you're trying to dampen it around the world. That includes, for example, the healthcare workers. You'd want your healthcare workers to be protected so they can work with people and not die, because it's a bigger effect in a way if a healthcare worker dies in a developing country because they have less healthcare workers. So that would be an example of inequities that you're trying to deal with. And often they relate to, a stigmatized group that, is just not given as much attention, or sometimes they relate to poverty and income inequality. Sometimes it's geographic. It used to be tukals, those are the little African huts out in the rural areas that people think of. But today it's often urban slums where people are living and are hidden away and in dense environments. So that's, what we do on the inequity side. In terms of vaccine hesitancy, this is about people not wanting to be vaccinated. And that's due to a few things. It's due to, obviously, a natural thing, which is, I love my child. I don't want it to get a shot because a shot's hurt. I don't want it to get a fever maybe or whatever. So there's some reality to that. But there also is misinformation and disinformation. And I separate those two. Misinformation is somebody who's not knowledgeable that says something, I think I'm giving too many shots to my kid because, they're too frequent together. That's somebody who doesn't understand the immune system and what it's designed for. Disinformation is somebody spreading intentionally stuff they know not to be true. And during COVID, we had Russian bots, Chinese bots, but even the U.S. government was spreading intentionally disinformation. I cover all of these in the book, but and that has an enormous effect, because what happens is if you hear that about one vaccine, you have suspicions that will affect you for other vaccines. So they're really different things, but I think that separation between misinformation and disinformation is important. Lastly, the misinformation is much easier to deal with because you can have an expert help you. Maybe it's a local community leader, a doctor, or a religious leader, can help get over that with the right information. Disinformation, which now is coming from political leaders, becomes much harder because you're in the developing world and you hear, I just heard this from this political leader, and he must know something I don't know, and therefore I'm going to be suspicious about this, and that's a challenge.
So we have a lot of conversations with people who are vaccine hesitant, and really one of the goals of Unbiased Science is to counter those falsehoods that people hear. And when we have those conversations, I would say 9 out of 10 people bring up the COVID vaccine and the pandemic as what spurred their general vaccine hesitancy. So there's a lot there. There's also a lot of confusion at the federal level right now in terms of what's recommended. Just a reminder to our listeners that actually the COVID vaccine is still recommended for everyone who's 6 months and older. At the last CDC's ACIP meeting, the Advisory Committee on Immunization Practices, many of us were concerned that we were going to move towards requiring a prescription for COVID vaccines. The good news was that we did not do that, but instead we've enacted this shared clinical decision making, which I think has confused a lot of people. Unfortunately, I don't know if you have any thoughts on that, Dr. Berkley. I think that it's just causing a lot of confusion for people, and people not even realizing, well, do I need to see my PCP? Can a pharmacist recommend it to me? There seems to be some different interpretations at the state level. Any thoughts on what's going on right now in terms of clarity on vaccination availability and recommendations?
Well, you just described the fact that you're almost confused and you're an expert.
Right.
How does the average person do this, particularly if in different states you have different requirements or different suggestions? And because the federal government is putting out misinformation and disinformation, now there's also a whole set of different committees. So sometimes some states have gotten together and they've begun to put recommendations out. There's professional groups, the Infectious Disease Society of America, the American Academy of Pediatrics. They are calling upon themselves to put out recommendations to help their members. And so, you have any of this, you have this many different ideas and thoughts. It just leads to confusion and misunderstanding. And at the end, that leads to distrust. So, COVID is still around. It's still causing disease. People are still dying from it. The point now is that it is not the same as it was in 2020 when nobody had seen this virus anywhere in the world. And, now most people have had some experience with it. Their immune system has had some exposure to it. And so it is not as rampant in terms of disease and death that it was then. But it killed lots and lots of people, and vaccination saved an incredible number of lives. And in fact, more people died of COVID in the United States than died, this was a comparison to military, than died in all wars in America combined from the after the Civil War going forward. So, this was a big deal, is a big deal. And the important point here is that if you're a young, healthy person and you've had some COVID shots and you may have had some natural infections, it's your choice or not whether you get another dose, although, they are recommended depending on where different recommendations. But clearly, if you are a person with, a very elderly person or a person that has, other diseases that make you at higher risk for severe disease and dying, then, it is potentially an absolute lifesaver. And so, the issue is trying to make sure that people understand what's happening and not being confused on this. And now even, people are talking about, whether measles vaccines are good ideas or not. Now, measles is the most transmissible of all infectious diseases. And again, prior to measles vaccine, and I'm old enough to have had natural measles, it killed lots and lots and lots and lots and lots of people. And, one of the things I talk about in the book was when I was in Sudan doing an effort to look at malnutrition. There was a horrible measles outbreak in this community, and we documented the worst malnutrition in history. 93% of the kids were malnourished, and every day we would count graves of babies that were died during the night from measles. So this is not a joke. It's not a benign infection. And, we now have the measles was officially eliminated in the United States in 2000. And this year we have, the largest outbreak since then. And it's continuing to spread with misinformation about the vaccine. So this is the problem we have.
Oh my gosh. That gave me goosebumps, that conversation about the malnutrition and the children dying. I remember my question. So Secretary Kennedy has come out and has basically said that, no, it's not the vaccines that caused that incredible drop in measles prevalence and incidence in the United States. It was actually sanitation. We have sanitation to thank for that. And I'm curious, I've had my own response to that. I'm very curious how you would respond to that claim, Dr. Berkley.
Absolutely not. Now, I will say there are other infections that are spread, what we call, and it's not a nice word, but fecally orally, that are, diarrheas and things like that. Those are dramatically affected by sanitation because, you clear that risk of transmission. But measles is a respiratory infection. And, as Sarah would tell you right now, these are not pleasant, but it has nothing to do with, fecal oral transmission and nothing to do with sanitation. And to give you an idea of how transmissible measles is, if you went into your doctor's office and there had been a person who had measles there 2 hours before, and so the room's been empty for 2 hours, you can get it just going in there. That's how incredibly transmissible it is. And the only thing that has stopped the transmission has been the absolute widespread availability. Now, why is that important? Okay, it's important for the individual child, but some children don't have a take of measles vaccine. And some children who are being treated for pediatric cancer or have immunologic problems don't have an immune system that can get taken. So we have a concept that's called herd immunity. And what that means is if you vaccinate enough of the proverbial herd, what happens then is if the disease gets into that herd, it won't be able to spread because everybody else in the herd will be protected. And that's the way measles control occurs because, if there will be people travel and, there's always going to be new exposures to disease. But if everybody is immunized, then they don't go anywhere. That person gets the disease, they get treated, and, it's over. It's only if you have a large number of susceptibles that you can have spread. And measles vaccine, because it's so infectious, requires very high coverage, like 95%. And so we call it the canary in the coal mine because it is the disease, as you see the immunization system getting weaker and weaker or less well used, this is the one that usually you will see pop up and cause outbreaks.
Right. And we're seeing it now. Of course, everyone knows the West Texas outbreak. I believe it was 2 or 3 children who died, an adult died from it. And a reminder that death is not the only outcome of measles. We see other terrible things like SSPE, this encephalitis. We see immune amnesia, right? It's not just a binary live or die. I think people often forget that. Dr. Berkley, we've talked a lot about vaccines, but it feels like there are many other things that are under attack right now. And I feel like there's just this erosion of trust in the scientific and medical establishment in general, this vilification of, medication and pharma. It feels even bigger than vaccines. Before we hit record, we talked super briefly, but we talked about, things like Tylenol, of course, we see is in the news. All of a sudden, the circumcision. I mean, what do you see this? I'm sure as a bigger
now the new Antichrist Illuminati. As well.
Yeah, and we saw it with thimerosal. So it's like, what do you make of this? The bigger picture of what's going on right now in America.
I mean, we used to respect expertise and we used to expect institutions. And this is important. And a lot of this you can trace back to the epidemic. I mean, some of it was weakening before, but here's what happens in an epidemic. On day one, you don't know anything. And so the question is, anybody, John Doe can say something, and that I suppose you could say that's right. But if you wanted to be a betting person, you would say, let me go to the person who has the most experience, has the most knowledge, because that'll be an educated guess. But one of the things that'll happen in science is that then you will have the recommendations change. It'll change because you have observation, you have studies, and over time it'll change. And this is where it's been so hard. For example, initially they said they had to say something. They said, we don't know if it not spread respiratory, masks, yes, no, what type of mask, we don't know. Is it droplet? Is it aerosol? Something like we need to be 6 feet apart. Now, where did that data come from? Is it really not 5'11" or is it 6'1"? Well, it's a reasonable, guesstimate, but from somebody who's knowledgeable about the spread of infectious diseases. And the point is that what we need to have people understand is that once you get that more data, then the person who's an expert, you just come out and say, well, now we know more and we're changing this recommendation. We're adjusting it. And that's what's important to have happen. But at the end, right now, we have people go to Dr. Google or they go to, somebody on the internet who is, having their own riff on a certain thing and maybe to sell products or do whatever. And so you end up with all of this misinformation. And because there's no trusted source, then what happens is people are confused and they go with, whatever feels right to them. And that's not the right thing to do, particularly for something as important as your health. And vaccines particularly because, they are prescribed by medical professionals because they're not over-the-counter things that anybody can do. They're things that need study, recommendations, understanding before they can be used.
I have one more question and then I'll shut up. And Sarah, I'll turn it over to you. Maybe you could then ask our closing question. But so something more philosophical that I've noticed. So, and maybe I'm sure you have an interesting perspective, but I mean, for multiple reasons, but also because you live in Europe right now. But the U.S. historically has taken a risk-based approach where other countries have taken more of a precautionary hazard-based approach to things. Here in the U.S., historically, it's more like we need, burden of evidence. We take into account things like likelihood of exposure, things like that. Whereas in other countries, it seems like it's more, well, if there's potential for harm, we should take action. I don't know if you agree with that or not, but I think that's sort of just like a general approach. And it feels like in the US, we're moving, like our threshold is changing, our threshold for risk, and we're becoming, I don't know, more risk averse or more health anxious. I don't know what it is, but we're moving, in my opinion, more toward that precautionary model. I don't know. Am I making any sense? Do you have any thoughts on this, just more philosophically?
Well, I think, philosophically, the problem in health care, I'm shifting slightly that term care. The U.S. doesn't have a healthcare system. And what's interesting is that the way you think about trying to have healthy environments is through prevention. And so, in a sense, this move that you're talking about is people focusing more on prevention. And it sounds great. You need to exercise more. You need to not be exposed to microplastics. You need to have good nutrition. All of that is a prevention-based kind of movement that I think is a positive thing. But the devil's in the details, because if you say, oh, we need better nutrition and what you need to do is buy my bottled gook that costs this amount of money that's going to, cure you of all diseases, and do that without any data or anything behind it. And that's really the problem, is the concept behind it is right, but the implementation really has not gone the way it should. And I think it puts us at more risk. Where we have a problem now is, in Europe, they're willing to accept the fact that they're trying to do something that's good for the whole population. In the U.S., there is this, I want my freedom. I want my health freedom. I want to do what I want. And just like we talked about a minute ago with the herd vaccination, you can't do what you want and have herd vaccination. So you have to decide which of those is more important to society. And I think, it's the same issue that's being discussed with fluoride. Do you want the young people have, their enamel strong so you don't have cavities, or, you can't do it for, just a part of the population in drinking water, and et cetera, et cetera. So these are the issues. The same thing with pasteurization or whatever. I think that's the big difference, is this, we want this freedom to do whatever we want. And it's interesting in vaccination, if you don't get vaccinated against tetanus, you don't transmit tetanus. If you get tetanus, it's a horrible, horrible death. Horrible. But it's you. Now, if it's a kid, the kid can't understand that. An adult, I don't know, but it has cost to society. You can make all those reasons. Measles is different, because if you get it, you're going to transmit it to everybody else. And so, there is the parent whose kid dies because somebody else transmitted to them. What rights do they have? So these are the discussions that we have to have in terms of using public health and public tools to try to make sure that the population stays healthy. That's how we drove our mortality rate from 350 down to 5, and should be down to as close to 0 as we can get it, I think, from an ethical point of view.
Beautifully said.
We say that vaccination and public health is a team sport, right?
Yes.
Requires all of us to take an active role.
All right, Sarah, what's our closer?
Yeah, so on that note, we like to close out our episodes, but with a little bit of hope. So, Dr. Berkley, would like to ask you if there's anything in the news or in the world right now, in public health or science in general, that's giving you hope for the future.
Yes, absolutely. And I mentioned this a little bit, but we're in the middle of this renaissance of science that can make a difference. And, the fact that we're seeing, for example, we have our first vaccine against a parasitic disease, malaria. We've have a few vaccines against cancer. I've talked about infectious cancer, but now vaccines are coming against cancer antigens, which will allow you to do primary prevention against cancer. But we're also seeing things like gene therapy for Huntington's disease. Who would have ever thought that you could do that?
I was actually just talking to my class about that yesterday. One of my class, it's really remarkable.
Yeah, it's remarkable, and it's not convenient at the moment. You have to open the brain and put the stuff on it. But for a disease that's horrible and a slow, terrible death, I mean, it's amazing. I mean, people have a physician friend of mine just did this with hearing, where they were able to go in and treat kids with congenital deafness by injecting a vaccine equivalent that brought genes in to replace some of the proteins that were missing. So we're living in this amazing moments in science and technology. And so I think if we can get back to believing in science and technology, and if we can go back to appreciating the importance of funding it, and I'll just say as an aside, we've seen recently that, we're going to give Argentina $20 or $40 billion. That, by the way, is more than the entire budget of USAID we got rid of, and so I don't really understand our priorities. But if we get back to that, then I think, for the next generation, they will see even better health and better prevention. And, we're on the cusp of being able to really, really make people, the goal would be everybody lives until they age they're going to die, and they die in their sleep peacefully, and that should be, up on in the 80s, 90s, 100 years of living healthy, of living in good health. That's what our goal should be if we want to, maximize, take health off the table as a factor for people. And science can get us there, but only if we let it.
Berkley, you are a treasure trove of information, public health royalty. Everyone should go pick up a copy of his book, Fair Doses, an insider story of the pandemic and the fight for vaccine equity. We will link to it in our show notes. I can't wait to read it. Thank you so much for joining us today.
Thank you for having me.
Thank you all for tuning in. We hope you learned a thing or two. Please join us next week on your trusted source for no nonsense, just science.